Hello, everyone. My name is Nalakshi Gunatilaka. I am the coordinator for the Optimized Partnership Project. I'd like to do a quick demo of the Penn Computer Systems CAT4 Refugee Health module as part of the Optimized Partnership Project. So while this opens, to give you some background, the Optimized Partnership Project is a 4-year NHMRC funded partnership project to improve primary healthcare delivery to refugees. We're focused in 3 areas: Southeast Melbourne, Southwest Sydney, and Northwest Melbourne. And we're working with refugee health sector agencies in addition to academic partners to achieve our outcomes. So the Penn Computer Systems add-on report for refugee health was developed because there was a bit of a gap in terms of how we are able to extract information about refugee patients from general practice software and the usability of that information. So what I've got up here right now is the standard CAT4 interface. You'll see the standard range of CAT4 products over here. The additional work that Penn's done with us sits under the Programs tab and under Monash University Optimize. So once you click through, I'm just bringing up some test data to show you how this works. So there's a number of tabs up the top. Once the search is run, so I'm using test information, but if it was real patient data, these would be populated with the information of patients. So what we've got here is the breakdown of patients who are identified by their age and their gender. The second is a breakdown of patients who are identified as being from a refugee-like background based on their ethnicity. And the last one here is the actual refugee health component. So just to say a little bit about the search strategy itself, the Penn CS CAT4 product will look for a number of things in terms of identifying refugees. The first will be country of birth and year of arrival. The second is ethnicity, both in the coded fields. So for example, in Medical Director, there is a field for recording country of birth. That's a drop-down list, but also in the free text component. So in progress notes, comments, warnings, and other fields where it's possible just to enter free text. So in the output, you'll be able to tell where a client, whether the patient who's been identified as a refugee has been identified through the free text or the coded field. So the orange component here is a free text result, and the green one here is a coded field component. Once a patient has been identified as being from a refugee background or likely to be from a refugee background based on the parameters of country of birth, year of arrival, ethnicity, and indicated refugee status. So that means that in the free text notes, there's been a mention of refugee, asylum seeker, humanitarian entrant, and similar terms. Once that identification has been done, the search will also bring up a number of other clinical care indicators. So the first is diagnosis count. The second is whether a health assessment has been completed in the last 12 months, whether a mental health care plan has been completed, and the visit count, which will allow us to tell the proportion of visits where an interpreter was used. So that's the last column, and the orange one, the interpreter used column just here. So this is the first output that anyone running the search within the practice will be able to see. So the search can be run independently of the research staff as well for the duration of the project. The second it is a worksheet with line listed patient information. So I'm just clicking here on the country of birth coded field result. It's possible to select more than one as shown here, but we'll just go with one for now. And the worksheet is what practices will have access to. So I'm just pulling that up now. All right. So as you see, there are a number of identifiers here: patient ID, first name, last name, postcode, date of birth, age, gender, and then we're going into the refugee identifiers. So if it was a coded field search, the country of birth would come up in this column over here. If it was a free text search, it would come up over here. And if it was a free text search in comments and warnings, then it will come up here. And so these headers here show where the data comes from. For the free text searches, we're also going to see 25 characters on either side of the identifying word. So for example, if the word interpreter has been used, then the words adjacent to that particular word will be visible to give the viewer of this sheet some context about where that result came up. And so as we scroll across, we're going into the clinical indicators of diagnoses, what those diagnoses were, when the first visit was made, whether health assessments and mental health care plans have been completed in the last 12 months, visits, and then where an interpreter has been used. Right. So this is the version that's visible to the practice, and what we'll see in the de-identified worksheet, I could just get back into that. Select the same one here, but this time going into de-identified. And this is the worksheet that will be visible to the researchers. So we have a patient identifier for the software, postcode, age, and gender, so we can do an analysis or based on those demographic characteristics. But you'll see that name, address, etc., all of those identifying information has been removed. And then this will be extracted as an Excel file as shown here, saved, and subsequently taken away for analysis from the practice. And this, of course, is done with full practice consent. Right, that's all I've got to say. Thank you.